Broadcast is now starting. All attendees are in listen-only mode.
Hi, everybody. So still quasi good morning to those on the West Coast, afternoon on the East, and happy lunchtime for those of us here in Mountain Time. I'm Andy Dwyer. I am with the University of Colorado Cancer Center School of Public Health in a joint appointment with Fight CRC to welcome you all to talking to your kids about colorectal cancer. So we're very excited to launch our webinar today. I think we came out of Colin Congress this last week, and we're super excited about the young advocates and number of people that were engaging in the work. So I think it's really awesome that we have Leslie Welch, who's joining us today to talk a bit about connecting with kiddos after cancer diagnosis and talking about CRC and survivorship, as well as the realities of a cancer diagnosis. So just a quick note, we were going to talk a little bit about it here going forward, but just a note that there will have an opportunity to ask questions real time through keying in specific questions, thoughts during the webinar. Today's webinar is archived as well as many of the webinars that have been pre-recorded previous at the fightcrc.org webinar site. And just a note that we are going to be following along with Leslie as she talks with social media, with Twitter, as well as Facebook and the like, to share some of the highlights of today's webinar. So it's always fun to check those, forward along to folks to share the best and fun themes from today and really good expert advice. So we will be posting the webinar, and then just for those who have registered, it's always good to get feedback from you about what you think about what we're doing, covering today's topics, as well as other issues that we might need to address. Next slide. So as noted, on the right-hand side of the screen, you'll notice the webinar function where you can actually add in your specific questions. So if you go to the side control panel, you can open that up. You can using the arrow box, toggling up and down, and then go ahead and enter those questions that you have real time. And so I want to just remind everyone that because this is about general education and support, we will not be able to address any specific medical individual questions. And if we got a ton of questions, we'll try to answer all of those post-webinar. We might not be able to get to all of them today, but we see some themes that typically come up, and we're able to address most of those. But it's really important to us that you share your information, insight, questions as we go along. So that's a great feature. Just go ahead and type that in today. There won't be an audio opportunity, so we'll need you to type in your questions during this webinar using the webinar control panel. Next slide. And just a quick note that Fight CRC does provide a number of opportunities to engage for patient education. The clinical trials mini-mag is one of our most popular, and just a note that our mini-mag are an opportunity to dive in to some specific topics, even a little beyond just a one-pager, but they're a great opportunity to facilitate conversations with medical providers, education for yourself as well as family members. The Guide in the Fight has been actually reformatted over the last year to really think about the three different parts of the treatment continuum. And just to note that that's on our website to download, still by far most popular. And then I'm excited to remind everybody about the Tabuti podcast series, where we really tackle some provocative questions and thoughts related to colorectal cancer diagnoses, from treatment, symptom management, other types of symptom management, and just living life after a colorectal cancer diagnosis for family members, caregivers, as well as for survivors. So check out all the resources on the Fight CRC site, as well as any of the archive resources from today. Next slide. We want to just do a quick disclaimer, and I think I said this as we were talking about keying in any real questions, just as a reminder that we provide these webinar series as an opportunity to engage, provide oversight, or just overviews, details, information about the treatment experience, symptom management, as well as how to support each other emotionally, as well as resources and support that your providers and caregivers will offer a standard of care, as well as information about clinical trials. But this is not at all a replacement for any direct medical advice or care. And just a reminder that if you ever experience any medical emergencies, dialing 911 or an emergency room is the best standard. And that, of course, we'd ask you to connect with your treatment providers about any information that's provided today, and that make sure that you use this as a guiding principle, but it does not, again, reflect any direct medical care, replacement, or diagnosis. We really need you to connect with your health service team about where you're going with the future directions of medical care, and we're here to help guide that, but not a replacement. And again, a note that we won't be tackling any very specific one-on-one questions today, and our team will try to address some good themes going forward, but not the one-on-one questions. Okay, next slide. Okay, so with that, I'd like to introduce Leslie, who is part of Leslie Welch, who is a native of actually Nashville, and we're excited because we've done a lot of work with many members of the medical profession, as well as a lot of the folks who are in the greater Nashville area who have supported Fight CRC. So we've worked with Gilda's Club and Leslie over the last couple of years with some of the support work with ambassador training and the like for Fight CRC. So just a little bit about Leslie as she talks today about supporting kids and thinking about how to tackle the idea of survivorship and cancer with kiddos. Is she has a lot of great experience in terms of a master's degree in child support. She spent time at New York Presbyterian Weill Cornell Medical Center, as well as the William Randolph Hearst Burn Center, in terms of thinking about how to develop and support kiddos and the child life programs in terms of pain management, palliative care, and worked at Memorial Sloan Kettering in their surgical services area. So she's part of 2014, she was part of a private child life practice concentrating on psychosocial needs of siblings of kids challenged by chronic medical conditions. And as she has created the Punch Pillow trademarked tool to help kids 4 through 8 safely express concerns and emotionally develop healthy communication strategies around pain and chronic disease management. So as a program manager at Gilda's Club, Middle Tennessee, Leslie facilitates the programs for kids for age 4 and older to help them process and communicate about why they or someone they love has cancer or has died of cancer. And so we're really excited to have Leslie help us really delve into this very important but very sensitive topic. So Leslie, I'm gonna let you take it over from here and just say on behalf of the Fight CRC community, we're super excited to have you. And before we do that, I just wanna welcome back Sharon Worrell from maternity leave, who's joining us back today. And a huge thanks for our Fight CRC team, Andrew, Elizabeth, Danielle, and others who will be helping support, and of course, Michael Sola, who's the VP of Fight CRC on the line today. So I'll let you take it over from here, Leslie.
Well, thank you very much. And Sharon, yes, welcome back. I'm really excited and very grateful for this opportunity. So thanks so much for having me. It'll be great to speak with all of you today. I'm excited about the Q&A at the end as well. It's certainly can be a very scary topic to discuss, and as you have very well outlined, and a very critical one. Particularly kids today are so exposed to an extraordinary amount of information, and so it's really important that we stop and support them through the process of just trying to make sense of it all. Excuse me, I'm trying to, sorry about that. For those of you who are unfamiliar with Gilda's Club, we are a free cancer support community for anyone impacted by cancer in any way, whether that be the person with the diagnosis or the family members and friends, loved ones, because we know and truly understand that cancer impacts not just the person with the diagnosis, but everybody surrounding that person as well. We are a community supporting people all along the cancer experience and continuum, which is a significant one, from new diagnosis to people who have or were impacted years ago, including those who have loved and lost someone to cancer. That said, one of the best things that I have experienced here is that we really witness people living through a diagnosis and living well with a diagnosis. In fact, we have a lot of people who comment that they live well. We serve men, women, and children equally. And as our tagline there says, we really, our mission is to help the community be empowered by knowledge, strengthened by action, and really sustained by the community. So My objectives today, as you mentioned, it's tricky to address everybody's unique individual challenges and needs, and I will try to do so as much as I can. But I'd like to really just give you some guidelines that will hopefully at least increase your confidence in talking about cancer and supporting your children through the whole experience. So we'll do so by creating a guide for a communication plan, which will include providing accurate information, like explaining cancer in very, very simple forms, explaining treatment and possible outcomes, discussing the practical implications for kids. As a child life specialist, that's what I'm trained to do, is to really break it down so that kids can, as I said in the beginning, make sense of it. That's how they will cope most effectively. Then we'll touch on assessing emotions and evaluating needs, and understanding some of the resources that are available to you, which are plenty and all wonderful. My disclaimers in this one is that I really want you to understand that I understand, as primary caregivers, you are the expert on your child. You know the child's temperament and reaction style and triggers and who's in their social network and all of the components that make your child your child. And that can also be plural, of course, children. Also, if I say caregivers throughout this, it's really anybody who is playing a significant and critical role in a child's life. We're in a modern world with modern families, and so I'm not just referring to blood parents necessarily. So again, this is a general guide to help outline best practice and offer suggestions on how to navigate the conversation and be prepared for how to handle some possible reactions. I understand you might be in a parental role. This could be, you could be listening in a school setting, healthcare professional, or in some way shaping a child's life. So please know that, you know, you matter, and we're all in this together. So let's, as y'all said in the beginning, let's support each other through this. I think to remember, this is typically helpful. As I said, you want to break it down to the most basic. And so one of the ways I do that, and for visual learners like I am, it's important to break it down into incremental timeframes and incremental thinking. In my experience in all of my hospital settings and also here, the pace of medicine and the information that's coming at us from the medical world is obviously necessary, but it's always going to exceed that of the course of human development. So breaking it down into steps or sections is just greatly going to increase your chances of effective communication and understanding, comprehension, and emotional safety. You're not overpowering or overwhelming children when that's unnecessary. So you'll want to think of time increments that are within a parameter that's feasible for you. So, you know, if you're running a marathon, you don't get out there and run the full marathon. You train with either sprints or certain legs. So what is going to be important information for each leg, or in a ruler? Break it down into tiny measurements, kind of whatever works for you. I'm sure there are plenty more metaphors out there. Before we get into the meat, again, this is also really important for you always. Put your own oxygen mask on first. So that's going to be in the form of expressing your emotions. If this is a first-time conversation, get out your feelings first, because you need to purge those in order to be able to support somebody else. And it's most helpful before any conversation happens to understand what is the next step. What is your treatment plan going to be? It's also important to get your own support network in place and support systems. It doesn't mean you have to have everything pinned down exactly, but you can certainly have a couple things going so that you feel supported as well. And the sooner you get those into place, the better, because it's the more support, the better. Evidence has suggested that a well-established risk factor for adverse childhood outcomes is due to parental stress. So that could be aggression, behavior problems, anxiety, emotional coping, child social competence even. So again, support, and take care of yourself first. So let's talk about this communication plan. It's important to think about this throughout your whole cancer experience, because it's not going to be just one conversation. None of this is a one and done. There are, of course, many points to address along the way. And so think of this tool right here as something you can use at every point when a conversation needs to happen. So the 5 things: who, what, where, when, why. And the reason that what is in all caps and bold, is that that really is the meat. The other considerations are important considerations, and so we'll go through those, and then we'll get to the what lastly, so that you really know what to say. Once you have your information and you've allowed yourself that moment to release the emotions surrounding it, then you can start forming your plan and introduce the news to the child or your children. So who's going to be involved in the conversation is important. What, where, when, why. So let's investigate those a little bit further. The why, although it seems pretty self-explanatory, it's important to just go over it really quickly. I do understand that you don't really want to have to share the news, but the challenge with keeping things secret and why it's important to share news along the way is that secrecy in completion is something that can then lead the child to thinking that something is going on. They'll definitely know something is going on, and their imaginations can make it such that they think something much worse than actually is happening is going on. So that's why it's really important to sit down and give them the space and the trust and respect. You're also giving them an opportunity to promote and demonstrate their resilience. Kids are insanely resilient. It's one of the best things about them, and we can learn so much from them along the way too. So if you don't share, then you're limiting that with them. You're also fostering communication for everything in life. All of this can actually go for anything in life, not just the cancer experience. Allowing for post-traumatic growth, I will say there have been studies that show that a parent with a cancer, particularly in teens, that when they are, one of the positive outcomes of it is that they in turn have an increased appreciation for life and gratitude, and it carries them through their life. So again, if you're wondering why you're having to share this news with them, there's a reason right there. You're giving them ample, wonderful legs to stand on, so to speak. So when there's, everyone thinks there's never really a great time, and of course you don't really want to have to share anything, but you know why. And so when, it's a good way to get your ducks in a row, so to speak. If you're dealing with more than one child and they're each in different developmental stages, then understand you might need to gather everybody together for an initial conversation, and then there might need to be individual talks with each child so that you can really address the need of each child. So know that might be something. But the time to talk to them is when you know that the treatment is going to impact the daily life, meaning the routine and any physical changes that this child might witness. That's when you need to speak up. When you also know your plan and immediate next steps. So that's what I said prior, which is what's your treatment plan going to be? That way you can say, here's the news and this is what we're doing with it. It will help give them control throughout. And when everybody can be together. So even an instance in starting to give them control through this whole experience, which cancer is a control enthusiast's nightmare because it will constantly try and take the reins of control. So let's start from the beginning by giving the children control when you can. So for example, if you've got people in the house and you want to try and get them all together, you could say, I want to have a talk with you about something important. Would 5 minutes from now or 15 minutes from now be better for you? And that it seems like a very simple choice, and it is a very simple choice, but it's one that gives them a little bit of mastery. Where? It's a pretty simple one, except that just make sure you don't have any distractions, attention span challenges. We don't want to increase those. So if you have the luxury of being home, you may be in the hospital, in which case you just do the best you can of where you all can gather together. If you are at home, again, try and have no distractions, where it's familiar to children, where everybody can be comfortable. Some people have chosen the family dinner space so that they want them to that's where their safe talking is. And so that might be where it is. Perhaps they want to be outside so that children can pick grass because it's a little nervous thing that they like to do. Then you're speaking to their needs and desires. I think you'll probably be able to trust your intuition throughout this whole plan. And don't forget that these are guidelines. You are your expert. You are the best to know a lot of this information. So these are just hopefully helpful tips and tricks. Who needs to be part of this initial conversation? And any of the initial conversations along the way where news is being shared, I think the most important group is the group that is within the household. So whoever that primary household members are is the one that needs to have the initial conversation. That's where the day-to-day is going to get disrupted or impacted. And so you can all support each other in that capacity and then move outward. So then outward would be family members who play a significant role in the child's life, which is part of their support network. There is also their support network of friends and parents of friends, any school staff, coaches, clergy, therapists, babysitters, anybody who's playing a caregiving role at some point in this child's life. Studies have proven that children can find relief from their own support network and can even cope better within the first few months of a diagnosis if they lean into that social network. So if they were to ask you, can I share this news with people? It's very positive to say, well, it's your story to tell. Tell me what you understand and what you will share with others. And we'll get to that in a minute. But that this isn't something that needs to be a secret. There's nothing shameful about this. And it's also an opportunity to educate those who might not have accurate information. The child empowerment moment, as I like to call it, is to involve the child in the process of sharing. So how do you want to share this with them? And what is the information that you think is most important? It gives them, again, control over their own experience, and it also shows them that you respect and value their thoughts and beliefs. Family that I worked with had a coffee talk at a child's school. It was a very close-knit school, and so to just make sure that the family had control over the whole experience, as much as they could, but at least this initial part of it, I helped write a script for them, with them, not for them, but with them, for the child's. They had a coffee talk with the child's school, the parents of the children at the school, so that everybody could be on the same page and really diffuse any sort of potential rumors, whatever may have gone around. This slide is pretty information heavy, and so I just want to stress that this is a guide. You can use this you can reference it as a guide along the way, as a way to gauge behaviors. It's typically developing as well. Everybody is unique, of course. And so I just don't want you to stress about having to memorize all of the reactions, or if you see something in it and it causes concern immediately, don't worry so much about that. It's really just meant to give you kind of a broad general outline. So things to point out is in the 3 to 5 year range, maybe into 6 years oldish, again, a general. It's just constant reassurance that this is not their fault, that what you're sharing with them is nothing that they have done. That can tend to, there's a lot of internalization that can go on and misconceptions. And so just please be mindful of that. Everything needs repeating throughout the process, but that's an important one. And then on the teen end, there's evidence to suggest that teens can experience a higher incidence of stress and their stress response symptoms, partially due to just where they are developmentally. They're kind of wrought with righteous independence and trying to exert that. And yet, if a cancer diagnosis impacts their household, they might be called upon to take on some more responsibilities. So there's the balance between that, and they may not have, fully developed coping mechanisms. As adults, we sometimes have challenges with that. So it's allowed in the teen years as well. And they are also, they do understand, and they do have the ability to think ahead and worry, which is what can happen. They can worry more. And so there's disguised worry if they just don't know how to process that or don't know how to talk about it. Know that is normal to a degree. And so so it's important to support them through it. So I know y'all have been waiting on this one. So the what? The next few slides we're going to go through kind of what do you say? What do you talk about? So we'll do an example of an introduction and a very basic explanation of cancer, the treatment and possible outcomes, and then creative coping strategies and some suggestions that have been really effective in my practice, but from our families as well. And why those are really, really important. And I do want to say the explanation of cancer and the treatment and possible outcomes, can get very science heavy, so I have kept it very basic because truthfully, the science comes maybe later. I think when you're hit with a big piece of information, you want to process that first, and then the little nuances and the real explanations, or maybe the more science specific for the children that are interested in that comes a little bit later. Before I get into any of that, however, this is probably one of the most important slides that I think is in this presentation. Language is so important. And so I've given you a couple do's and don'ts just to mind, because they're ways of thinking about things. So do use the word cancer. I've worked with some families over years ago that wanted to name it something really clever, and I appreciate that. The challenge with that is it became really confusing for the children. So use the word cancer. It's truthful, it's accurate, it's what the kids are they need to hear, but it's also what they are hearing. And so if it's called something else, that can be really confusing, particularly if they're in a developmental level where they don't understand it as much. They'll feel educated, empowered, and trusted that you trust them to handle this big word. The good news is the more comfortable you are using the word cancer, the more capable they will be able to process the impact of it all. Again, if you're not talking about it, they might imagine the worst, and they might imagine that we're not supposed to talk about it, and there's something really bad and wrong and shameful about it, which is not the case. Do give kids the opportunity to tell you what they know. So asking them, hey, what do you know about that? What would you tell? Like when we were saying, reach out to your support network, what would you tell them? It's your opportunity to clarify any misconceptions and to see if they're actually listening to what you're saying, like if they're processing correctly what you have shared with them. Check in frequently to assess how the kids are feeling. I think that's always a good thing to do in life in general, but particularly through a potentially traumatic experience like this. As I said before, keep it simple. Children process information in their own ways and actually will indicate with you when they've heard enough. So that's why you want to not overdo it with too many words because you might lose them. So indicators that you might notice would be they would change the subject or walk away. It doesn't mean they're necessarily trying to be rude. It could be a way that they're saying, I can't process this right now. I need to take what you just told me. I need to go think about something else. And then I'll come back to it. So just be gentle, follow their lead, revisit the topic when the child is ready. It is really okay and encouraged to truthfully say, I don't know. You are not expected to know everything and have all the answers. It's an undue pressure that I think a lot of people put on themselves, and it's not realistic. So take your own stress off and just say, I don't know. And it's a way to say, that's a great question. I don't know the answer to that. I will work on figuring it out, or I know who to ask though. So it's something that they will appreciate, that you're willing to be vulnerable in that way with them, and then allows them to be the same. On that note, it's okay to cry and laugh with your children. That's being real. Every now and then you're going to want to probably let out a big cry, and it normalizes their own experiences. Kids definitely need permission to feel the full range of emotions, and so they look to you as a model. If you are letting it out in a reasonable manner, then they can feel comfortable to do so as well. On the don'ts, just a few, but it's really important not to use the word sick. Use the word cancer and then other descriptors. The word sick can be confusing for kids. Most kids think about having a cold or a flu, right? They stay home from school because they are sick. So the next time that they are sick in that way, they might then think that they've got cancer too. So we want to reduce stress, not increase stress. So just make sure you are constantly making that distinction. A tummy ache is very different than cancer in the colon. And we'll get to that in a minute, but just remember that. And don't say there's something wrong. The word wrong, it's not catastrophic if you use it, but the reason I put it in the don't category is it's more of an evaluation rather than a fact. So what you do say instead of there's something wrong with me is there's something inside of my body that isn't supposed to be there. So we'll get to that again in just a minute. A good way to transition into the conversation as smoothly as you can is to reference any symptoms that have been happening or that the person has with the diagnosis has been experiencing, which led to the discovery of the cancer, because then they can start understanding and linking the process. One of our families shared what was effective for them, and so yeah, I'm going to give you that example because I think it's a perfect example. But then you could say something like, you know how Dad's stomach has been hurting him for a while, bathroom a lot more than he usually does. Well, if you ask him about this change in the way he's been feeling and behaving, and we had some pictures taken of inside of his body. I'm really glad that we did all of that because we learned that Dad has some cells inside his colon that aren't supposed to be there. And at this point, you can either say colon is its job out of the body, and either answer yes or no. It's an opportunity that they're teaching you. If they say no, either way, you're either going to confirm or educate. And essentially, you can discuss what the role of the colon is. They love when you talk about poop. I will say that more day than I ever thought I would growing up. But it gets them understanding their own bodies and health. And when things get off kilter, so to speak, with the person with the diagnosis health, they can under that. Plus, it's all something they love to talk about, and it's supposed to be this taboo topic. And yet, when you do bring it to the forefront, then it makes them giggle a little bit, but also it kind of diffuses it, and then they don't think it's as fun to talk about later on. So might work in your favor too. So there's the mini science moment just in general health, but then you can say, so the cells that were inside of his colon that weren't supposed to be there, those are called cancer cells. Do you know what cancer is? And this is where they may have heard about cancer in the past. They may think it's something that immediately means death, and so you can correct that as well. Ask what they know. Always distinguish cancer-related symptoms and side effects from non-cancer related sick feeling symptoms. I touched on that earlier, so if there are any questions on that in the end, I'm happy to revisit this topic, but I mentioned it, so I don't want to stick on to that one. But it's, again, just reassuring these kids that it's a very different situation. It's unusual to their situation when they've got a tummy ache or when they are constipated and have to go to the bathroom later on. And then mention that this is to worry about all of the time, because that can happen too. So what is cancer? Very basically, cancer is a disease of abnormal cells growing out of control. You can talk about that everybody has cells, and we need the cells to keep our body functioning properly. And then there are those cells that are not supposed to be there and are malignant, which can be very harmful to the body and even have the ability to take over. Okay, so this is a picture, by the way. The pictures on here and at the top was an activity that we did with some kids. We took some Play-Doh and said, hey, what do you think cancer looks like to you? And so it was a great way for them to then also start talking about cancer, but they had their hands busy. Keeping your hands busy actually relaxes the mind, and so they're a little bit freer to talk about things. And they created some cool images and stories of kind of what they thought, and so it was a great opportunity also to clarify potential misconceptions that were out there and confirm what education they already had on it, which is great. The one other word I have in here is polyp. So that's, of course, very normal in this crew to talk about, and it's not necessarily meaning cancer. The word polyp does not mean cancer. It is just an abnormal group of cells worth investigating, but it doesn't necessarily mean it is cancer. At this point, like I said, science might be something they just don't want to consider. If they do, you'll be able to understand just by their behavior kind of how much more information they really want to dig into. They might be done at this point as far as hearing about the actual science part, but then you might have some that are really interested in, well, what were the pictures that you took? And you can talk about how cool it is that there are these machines that are and tests that are able to see inside the body since our eyes can't. So you could talk about a colonoscopy, a CT scan, biopsy, MRI. The chances of that, in my experience at least, have been really low. So I'm, again, happy to talk about this more at the end if questions come up. Given that it's usually low that they ask about all those types of scans right in the beginning, it might come up way down the road. I won't focus too much time on that. Additionally, as you're thinking just down the road, every time scans do come up, there's a term that I've known for years, as I'm sure all of you have, which is called scanxiety, which is the anxiety that comes with preparing for scans. That is not a word, I think, that really needs to be a part of the daily language for children. You know, we really want them to be able to focus on their own lives and provide them with the information when it's important. So I don't think you need to tell them when you're going to have scans or another colonoscopy or anything like that. If it isn't going to be necessary. What might be necessary is when you have news to share after those scans. Again, that's a guideline. Your situation might be a little bit more unique for information sharing. This is also a super important slide, in my opinion, because it's really important for what kids should understand about just cancer in general and the experience. So it is absolutely not contagious. We know that, they don't. I hear it a lot with kids who I would imagine already knew that, and so they have to correct them on that one and educate them, and that's okay. It's not their fault. It's just the information they've been told somehow or understood. It's important for kids to know that having cancer and being diagnosed with cancer is also nobody's fault. We don't know why all the time why someone gets cancer. Most of the time we don't. But we do know how to treat it, and there's a lot of action that we can take to getting rid of it and living well. You're allowed, children, to keep hugging the people that you love. I think that just reinforces the first point on the page, and also it just keeps that connection and it affirms what they want to be doing. It's really important for you to let them know that it's okay to ask questions when they're curious. That's going to come up. No question is a silly question. It might be something that even you're wondering. So again, you may not even know the answer to the question, but it's okay to say, you know, I don't know that, but let's find out together. Or just for them to know that you'll always tell them the truth. It, again, as I mentioned earlier, they know then that they can trust you to trust them, and they can go on and live their lives, and you'll share with them when they're ready. It's important, again, thinking incrementally. Focus on what you can control now and today, because thinking, you know, way in the future is something that can get out of control feeling. And so let's break it down. And so let's think of what we can do today that will make today a great day, or whatever you want to say on that note. It allows them to maintain control. And lastly, on this one, cancer is serious, but it's not necessarily fatal. Again, kids may have had experiences with previous people in their lives. Maybe it was fatal, but that doesn't mean that that's going to be the case in this situation. So it might generate the question, will you die? That's a very common question. So one answer might be, well, all of us are going to die at some point. However, I don't plan on doing that anytime soon. And I have a very hardworking, wonderful team of doctors and nurses and technicians and social workers and advocates and everybody part of the team who are working extremely hard to get rid of this cancer so that I can live a very full life with you. So that's what I'm going to focus on, and that's what I think we should all focus on. And I promise that I will always tell you truthfully what's going on, and I'll keep you updated and if anything changes. Again, that allows them to relax and trust that you will let them know when things are important to share. So quickly, just on the treatment plan, when you will know it when you're having this first conversation, so yours is going to be unique. Some possible treatment options, and kids really love pictures, by the way, so even just showing them what things are going to look like, it helps them prepare for what they might see or hear about. It also it does dispel some myths that they might have about some of these. So chemotherapy is a obviously very common treatment. If that's part of your regimen, then one way to describe it, you can say it's a special medicine that's aimed at removing cancer cells. That's very basic. One way to kind of help them understand the hair loss part of it, which is a possible outcome, is to think about, this is a popular way to talk about it, it's think about it as a garden. So imagine we have a beautiful garden with lots of colorful flowers, and now imagine that these weeds just start popping up, and we need to get rid of those weeds because they can take over and invade the flowers and be harmful. And so we have to use weed killer. We have to spray the whole garden with weed killer. And the weed killer kills the weeds, but it also damages the flowers. And that's kind of like what chemo does. It kills the cancer cells. It intends to kill the cancer cells, but it damages the healthy cells along the way, like the ones that help the hair grow or make the hair grow. And the good news, though, is that once the chemo finishes, the hair will grow back. So they can realize that this is just a temporary thing. Surgery. So surgery, it's a process when the surgeon removes an area where cancer cells exist. Sometimes they might ask about, is it going to hurt? They'll worry about if there's pain involved with it, where you can then introduce the word anesthesia. I didn't on this, just because, again, that's starting to get into a lot of more technical discussion, which I'm happy to go toward later on. But anesthesia is a special medicine that puts you to sleep for the time during the surgery and allows you to feel no pain. That explanation does it every time. It really kind of diffuses the fear that's there for pain. Radiation, which is something that may or may not be part of your plan, uses radioactive rays to shrink or kill the cancer cells. That also, that's the picture up on the right. They think it's kind of cool to see that. Lots of kids think it looks like a spaceship or something like that. And they can also understand that it doesn't hurt either. Again, just helping them with their worry about the pain. The other type of surgery is to mention, if this is part of your plan, is a port insertion. So again, you don't have to get into the real nitty gritty of it, but you could say there also might be, I'm going to have a surgery where they'll put a device called a port in, and that is something that lives inside the body temporarily while I'm getting treatment and helps the medicine get quickly into my body and very safely. That, again, it's very simple, but it usually does the trick as far as it's answering the questions that they're really having. And if they go more into it, then great, and you can discuss it a little bit further. They'll probably see you, the fatigue and nausea. Those are things that will happen. It's making the body work really hard, all of this treatment. We're really working hard to get rid of this cancer. And so that can make you feel really tired. So you might notice that mom, dad, aunt, whoever it is going to be tired sometimes. So we'll just have to work around that. Nausea, lots of these medicines can just make you feel nauseous as well. It means that they're doing their job. The fatigue and nausea are two of the ones that you'll want to make sure you're distinguishing. If they are feeling tired, the kids, if they're feeling tired or nauseous ever, just again, reassure them that has nothing to do with cancer. Colostomy, that may or may not be part of your treatment plan, but you can then explain that how you want to, whether it's permanent, whether it's temporary. It's a way to take the colon and put it through the belly, and so that the colon can still be doing its job. And they'll see the bag and they'll say, and the waste comes out this area right now, either while the other part is healing, and then they'll reverse that, or it's going to be a permanent solution. Again, I'm really grazing over that one just because it may or may not be part of your plan, and I'm happy to dive into that one more specifically later on if necessary. So practical implications for the child's day-to-day. That's really what's going to be living well with cancer, is how you're negotiating this. This as one of the pieces, I should say. So what are going to be the most noticeable changes? We just talked about a lot of the ones that they're going to experience. I think if you're in doubt ever, like, should I tell the child this? I don't know if they're going to even care. Go ahead and just say it. Even if it's, who's going to pick the child up from school, who will be at their games, or who's going to be babysitting a child, or whatever that might be. Even if you've already told them, or if you think it isn't important, go ahead and tell them. The worst case scenario, I always like to think worst case scenario. The worst case scenario in this situation is they go, "Ugh, I know, you already told me." Okay, well, that you can handle. That is not a big deal. Script for school is important. When they are ready to go back to school, they need to feel empowered. And I don't mean to be overusing that word, but it is a good one in this situation. So it's your job to empower them and prepare them to handle conversations independently. So without you there, and they might not want to talk about it, so you have to give them a way to diffuse the conversation so that they can feel, again, like they're in control. Additionally, not every child has accurate information, meaning every child other than yours, and not every child uses discretion. So that can lead to some comments that might not be the best at school. So it's an equation for rumors. If they're confronted and just don't, like I said, don't feel like talking about it right then, they can one thing you could tell them to say is, well, thank you for asking my, whoever it is, mom, dad, aunt, again, whoever that might be, is doing everything he or she is supposed to do to beat cancer and is doing well or feels hopeful, or whatever you think might be helpful for the child to just put an end to the conversation in a very pleasant, polite way. Again, it just gives them some control. So creative involvement. This is really where a lot of time is spent, at least in my world. It's a way for children to play through their experiences, which is one of the first primary ways that they express, especially when they don't have all of the words to really tell you exactly how they're feeling, or maybe they just don't want to. That's just not it's really not their MO. Like I said earlier, many kids aren't going to be able to hear and digest all of the information at first. So these are opportunities to help them understand what's going on and make sense of it. It also helps you understand what maybe needs some clarification, what needs repeating, where they need to express, and where you need to support, either just with, in the primary team or seeking outside resources. So some of the things I've listed on here, turning behavior changes into games. So if somebody in the house is going to be tired a lot, like, what are some great games we can play that require you to be quiet, maybe even hide and seek or things like that. Make it playful so that they're not feeling like they're having to just completely redirect their behavior, and somehow they think it's a negative thing. ChemoDuck is a fabulous, fabulous resource. I have used ChemoDuck for years with kids for all different reasons, as far as whether they've had the diagnosis or even whether siblings had a diagnosis, but a lot when the parent has the diagnosis, or caregiver. It is on the left side, you can see it's a huggable, lovable duck that has a port. And so it allows for medical play, and they can name ChemoDuck. They can really create an identity. They can take it with them. I've had kids talking to it and telling them kind of, what might you say to your parent, and role play in that way. And then again, the medical play piece with ChemoDuck, or even with Surgi dolls that are right underneath it, are ways they can play through and do some procedures on these duck or on the Surgi dolls, and let them really experience what they have heard about or they have experienced in some way. It's a really powerful tool. I've done so many surgeries with the kids on these Surgi dolls. They've taken out many parts of the body. The colon has been taken out and replaced many times in there. Creating a list of how the child can be helpful around the house. Children, it gives them control. They have a role. It doesn't mean start giving them a list of like 15 chores they have to now do after having to do nothing. Make it manageable, of course, but get creative. Give them a cool job title and responsibility, and they'll really, I think you'll see them taking ownership over that. One of our families, I loved this so much, because it was really a way to reframe their perspective, and they all did it together. By saying every time the chemo pump that the dad had at home, the portable chemo pump, it would click. And so rather than hearing that click and associating it immediately with cancer, they would go click, click. Well, that means daddy's getting better, or even the hair gone. They'd say, well, medicine's in the body. You can name the chemo pump, kind of get really clever. Use the Play-Doh. What does cancer look like to you? Two of the things that I've done here, when I'm feeling mad or sad, I blank to feel better. And we created a list, and there are things on there. I know it's a tiny slide, but There are things on there like stabbing a pencil into carpet. That's a good thing for you to know about, that it's really just a stress reliever. If it's not ruining the carpet, let the kid go to town, and it's a stress reliever. They're not actually wanting to physically hurt anything. It just feels good the way that it meets the carpet. That's at least what he told me. There's some other things on there. I'll let you enjoy those on your own time. Hit Me With Your Best Shot is a toilet paper target. They wad up wet toilet paper. This was all child directed. I have done so many of these things, all effectively. They're super fun. They're super fun to do with the kids too, because then you're joining in the process. It's not just them being vulnerable, having to share their feelings. It's you really are getting into it also. So it's a great bonding moment. This particular one said, "Don't let cancer beat you." Again, it's all child directed. I do nothing except tape that thing to the wall and make sure they don't, hit somebody in the process. If you aren't feeling like doing it, if you're not feeling well for whatever reason and you just aren't into it, if you can find a caregiver or someone else to do it with them, there's some evidence to prove that, healthy emotional sharing between adult and child can really help a child's function throughout the whole process. So those are all things to help them express when to worry. So the first 4 months, there's evidence that shows that within the first 4 months of the news being shared, it's of a diagnosis, or even a recurrence, those are kind of the highest points of distress. So I don't mean to say in 4 months and then one day after is when you don't start, is when you start worrying, but just know that that's a general rule, that it takes some time for adaptation. So if there's prolonged periods of behaviors and distress indicators like a complete disruption in behavior, challenges in school, loss of interest, isolation, self-harm, then that's really when you start to be available more to talk to that child. If you aren't able to do some of these strategies with the child, if you aren't able because you don't have time, and that's legitimate, especially if you're juggling caregiving needs of the adult and then the children, look to your outside resources, look to that social network. People are more than willing to help. And if you give them a task and help them say, "I'm really concerned, I need all hands on deck," that can be incredibly beneficial for the child and for you. And they know that there are people there to love and support them. That's only a bonus. And take your emotional pulse too. As I said earlier, your own stress level can certainly impact negatively your child. And so again, I don't mean to put pressure on you, but it's important to just make sure you're getting the support you need. I don't focus on young adults. I deal primarily with the children and the adults. So my day-to-day is not focusing primarily on young adults, but I will say this, they're still at some point, they're someone's child, and they're really trying to navigate how to handle their own healthcare needs. So particularly with certain inherited cancer syndromes that might be in the family, it's really important that you instruct them to communicate with a qualified healthcare professional to assess any personal healthcare implications, whether that's early screening or, they would be able to talk to the physician more about that, and be very open and honest and clearly communicate. That will only help them along the way. Estate planning information, it's something that people tend not to do until, it's almost too late or it's the last minute in life. And it's really important to just start thinking about those things, get them in place so that that's one thing off your list. And it's one thing that as a responsible, growing adult is something they know about what your wishes are. And it's also what their own wishes are. End of life. This could be a whole other webinar in itself and more. So my apologies for just having one slide. I think it's just important to touch on it. And there's a good tip in here too. To explain the reason for ending treatment. So let's say that's the situation. You're gonna stop treatment. You've been told that it's not doing its job. That's exactly what you say to the child. You can say, and children, we did everything we could. And sometimes it just isn't enough. The cancer has been too powerful and taken over. And so we have decided that we are going to stop all of that treatment, which has made me really tired and sometimes sick, so that however long I have, and that will, of course, I don't know what that's going to be, I get to spend it with you and enjoying my life and comfortable. And it allows them that opportunity to also create memories with you or whomever the person is, and as a family and as a big social network. And that's a huge, huge gift for, in all sensitivity of saying that word, to give them. Any spiritual beliefs, of course, are your own, and so that's a time to talk about that as well. Perhaps that's something it's a tool to help you through the process. Past and present, I just wanted to highlight that. It is a fabulous, wonderful book that is how to keep a memory and how to make a memory while either in the present or past. And it's got some clever ways of really capturing some memories together as a family. And I think if you read through that, even or whenever, it can make you think about what's really unique to your family too. I know we're wrapping up here, so I will not talk about every single book on here, but I've organized for our members here and for our people, and I'm happy to share them with everybody here, a literary resource list, and I've broken it into parent guides, body image, emotional awareness, grief and loss, and then cancer-specific books. And so that's, again, I could talk very lengthy about all of these, but these are tried and true books. I know there's tons out there, and so we vetted a lot of them and put them into this list. So please have at them. And then these are just some resources for you and your family. I think, again, these are tried and true, as is the, who we're on with today, but Cancer Support Community and my Lifeline, if you feel like there's some resources out there just to help you and your family, you can visit those and kind of investigate those more. Chemo Doc, I told you about that. Telling Kids About Cancer is another great website. If you don't feel like going through this entire PowerPoint again, this site helps you kind of create your script of if you need something like that to tell them. And it's similar to what we've talked about here today. Art with Heart is a fabulous organization with a lot of creative expression outlets. So I encourage you to visit them. The Dougie Center is a lovely grief resource center. And Camp Cussum is a delightful, well-organized, beautiful camp for children of a parent with a diagnosis. So I have 1 second. Sorry, I want to share something. That one of the children who was a child of a parent with a diagnosis was really kind of kicking and screaming to come here, did not want to be here, didn't want to deal with anything related to cancer, didn't want to talk about it. Finally came one day, and it was a long process of us building rapport and meeting him where he was emotionally. Cut to a year later, we're hanging out in our playroom area, which is called Noogie Land, and he was bouncing a ball, and he said, I guess we're all lucky, because if you don't have cancer, well, that's lucky. But if you do have cancer, then you've got a place like here, like Gilda's Club, and there are other places out there too. And he said, you've got a place like here where you meet cool people, and you get to meet people who are sharing the same experiences with you, and you really get to have fun, and it's not all so scary. And I just thought that was probably one of the coolest things to hear. This child was clearly demonstrating just how resilient he is, and I think it's a good hopeful thought for all of the beautiful children in our lives. So with that, I will allow you all to take the reins back, and I'd love to answer any questions if I can.
Thank you so much, Leslie. What a great presentation. I know this is a topic that a lot of people face, and so we really appreciate you taking the time out to share with us. So let me just go ahead and get the controllers here.
Sure.
Oh, and it took me all the way back to the beginning. That's all right. Anyway, so we do have some questions. Oh, here we go. Let's see. Oops, excuse me while I figure out my technology. No okay, here we go. So we did have just a couple questions come through, and we are the first question we have here is specifically around young children, so ages, around 2, 3, that don't quite know,
Mm-hmm.
you don't quite understand how sick a parent was. So just wondering, well, why does my parent go to the doctor so often, but perhaps isn't, old enough to really understand what's going on. So how open should a parent be with a child of this age? Or, is it just based per child? How can they make that decision?
Yeah, a couple things in that. I think that, one of the biggest things, like you said, and thank you for the question, whoever wrote in the question, that you're not going to be spending a ton of time on lengthy discussions with a child this age. They're really feeling the impact of their routine and attachment being disrupted. So as much bonding and reattachment, I should say, that you can get involved with this child is the better. I don't know if it's possible to even take children like that, these particular children, to the hospital with you. Sometimes I've seen that happen, and it's really cool. It just they get to see where you are. It doesn't necessarily matter. Again, you're not explaining all of the treatments at that age, but they're with you and they're with you through it. So that's one suggestion of something you could do. Going into it, I stick to saying cancer. I mean, I worked with a 3-year-old who was talking about saying cancer, and she can use it, and use it well. She uses it correctly. So you're not going to get into the science of things necessarily. Definitely use the word. I don't know if you can write in if that's answering your question necessarily. You're right to say you're not going to get in the weeds necessarily with all of the words. Certainly don't say sick. It's just back to that first advice I have on that slide of use the word cancer and don't use the word sick. So you're kind of shaping how they're gonna, what they're gonna start forming to say. So start correctly from the beginning.
Gotcha. Okay. So the person who wrote the question did have a follow-up. It's more about maintenance treatment versus just newly being diagnosed. So,
okay.
So long-term survivorship with maintenance therapy.
Yeah. Okay. I'd have to ask I don't know what that, I don't know what that specific maintenance therapy is. It doesn't sound like, unless the child is demonstrating symptoms of distress,
mm-hmm.
then it's probably not necessarily with that age of a child to really go into it too much.
Gotcha.
I think I'd probably have to know a little bit more about what that looks like with that maintenance therapy and what that is. Again, every situation is so unique, but I don't think that that's going to be paramount to discuss it too much with a child of 2 and 3 years old.
Sure. We do have a couple, just if you have time for 2 more questions here.
Absolutely.
Someone's bringing up the creation of the anger pillow. And so we're wondering if there is a softer toy, like a huggable toy, something less aggressive that might be useful for the child.
Mm-hmm. Yeah, and actually that's funny. We say pillows are for punching and people are for hugging. There is, they can also hug that, but I would say the chemo duck is something, are you wanting to redirect the aggression, or I think that's the question to ask. If you're trying to tell them not to feel aggressive, sometimes that can actually work against you. You want to let them go ahead and get it out. So let them get it out in an acceptable manner. If it's something that they're feeling like they need to, maybe it's running around, maybe it's squeezing something. So get them those squeeze balls. Get them those squeeze balls where the eyes pop out, where it's kind of funny. So it'll redirect them in that way. I think don't necessarily squash an anger or an aggressive feeling if it's kind of a momentary one. If it's perpetual, then obviously you're going to want to seek some additional resources. But if it's something to just hug, you can choose from anything. And I think, again, chemo duck is an excellent one for that. I think it depends on what's happening with the child at the time, and not to say don't be upset or don't get aggressive. People, I'm not saying the person who wrote in is this person, but I have talked through this with other people, that you fear when a child gets angry. Again, if it's not something that's all the time, it's okay. It's something we feel angry. We adults do. I think we get scared when children feel angry because we don't want them to feel that way. The problem with not allowing them the opportunity to feel that way and just get it out in something that is safe is then it just gets stored inside, and they feel wrong, back to that wrong feeling for feeling angry. Mm-hmm. It's a good opportunity. I don't know how old this child is either, but start the conversation about anger. Start and validate it, so that they can start also incorporating some language so that they can process it. So that they can express it more accurately. Sometimes it's because they don't know what to say, and so they just physically have to let it out. So if you can encourage them and work with them, or have, many people working with them on, these are more productive. When you feel this is something, these are the things that you can tell me, or tell somebody else. So it's appropriate communication. That's frequently what it ends up being, but you've got to let them have that outlet to even get there, right? Like, it's kind of a crisis state to some degree in their physical. They have to get that out before they can even start processing anything cognitively. I know that went way off hugging, so sorry about that, but I do want to make sure that addressing anger is actually super important.
Right. That thank you for taking the time to address that. I know we're running a little over. I have one final question if you have time.
Yeah.
So this one is about someone who was diagnosed stage 4, has a child who's now 14. It's been a number of years since the diagnosis, and she's dealing with, or he is dealing with, typical teenager stuff, teenagers pulling away, wanting to, spend time on their own. And there's worry with the parent that there's not enough memories being made, and they're being, not spending enough time together during a challenging diagnosis. So what are some tips and advice to this person or people experiencing this?
Yeah. And I think I tend to have now like 3 questions after every question you've asked. So sorry about that as my pause. I'm thinking through this. It sounds like there is a worry on the adult that end of life might be something really to consider. I don't know, but just because not enough memories are being made, that's the only reason I say that. I'm of course not saying that that's what's going to happen. If that's the case, then I would say need to address that probably, so that the child or the teen knows really what's going on right now and has that choice to step up and be a part of the process. If that is not the case, that is fine, and I am sorry, but it would be one thing to consider. If, talking to the teen's social network too, and meaning like school, and is this happening inside the school as well, then that's maybe a more global issue too, of just what's happening with the teen in general. You get a better snapshot. What happens in the home is frequently not the same as what happens in the school, so you need to get an accurate understanding and picture of what's going on. Well, it's so hard to wrap this up in one little sentence. Sorry.
We can also address this in a blog post after. So I know people are probably having to head off line, but we can certainly address it in more detail. Q&A with yourself, Leslie.
Yeah, I think just be honest. Always honest. To try and pull them in. This is what's going on, and be vulnerable. I know that's really baseline, but that's my quick summation for answering that one.
Awesome. Well, thank you so much again for a wonderful presentation. Thank you to everyone tuning in. Of course, if you'd like to reference the webinar recording or check out the slides, you can find them in the resource library at fightcolorectalcancer.org, excuse me. where all of our webinar recordings live. You can have access to the slide deck. And thank you so much for everything. Have a wonderful day, everyone.
Thank you.